Can you hear me?
Yep.
We can.
Okay, great. I will flip on video here in just 2 minutes. I'm taking care of something real quick, but we can call the meeting to order. And sorry about that. Thank you all for coming. Let's do a quick roll call for Board Member Maggie Ballard.
Here.
Nick Day.
Here.
Sarah Dixon. I don't think she's going to be here tonight. Maria Elena Gonzalez.
Here.
Nalini Fraser, I'm here. Philip Fraser.
Here.
Denise Romero.
Nalini, Denise has resigned from the board, just effective this past Sunday. So just FYI.
Okay. Sabrina Shoemaker.
Here.
Madison Schreiner.
Here.
Rob Simon. And then Deb Groover. I think she said here. Maybe you're not muted.
Here.
All right, welcome. Hopefully everyone had a chance to review the meeting minutes that were emailed out. I noticed in the meeting minutes, and I don't know if this is very important, but it said that we met on WebEx, but I think we're using Zoom.
We can make that change before the meeting minutes are posted.
Is there any other thoughts or comments? A motion to approve the minutes from last month?
I move to approve the minutes from the meeting on December 14th.
I second that.
All right. Are there any opposed? Oh, I see there was a comment.
It looks like it just needs a vote now. There was a motion and a second. It needs a vote.
Okay, and all in favor? Raise your hand or say aye.
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 Aye. Okay, motion is passed. And it looks like they're asking us to make sure that all attendees, please make sure you're typing your name in the chat box so we can keep track of who is attending. And do you need us to do that for the board members as well?
We got the board members
And do you,
with the roll
got it.
call. Yep, thank you.
okay, great. And then I noticed Deb Gruber wasn't listed on the agenda for today, so if we can make sure that she is included, that would be great.
Absolutely, that was a staff oversight.
No, thank you so much. All right, so we can get started with our Mental Health and Substance Abuse Coalition report. I believe we have Jennifer Wilson with us. Thank you for joining. She's from the behavioral health community. She's the collaborator, and she is sharing her screen with us. So if you are ready to take the floor.
And hi, I'm Jennifer Wilson. I am the collaborator, and I work do a lot of the work behind the scenes with the Mental Health and Substance Abuse Coalition. And I was asked to come here just to present some of the work that we're doing and then some of our successes that we've had since the coalition's been established about a year ago. So I'm going to go ahead and get started. This is one of actually, the logo is a recent accomplishment for us to get something that was established thanks to Tony from the Arts Department in the county. But we were able to get a coalition logo, and we're in process of actually establishing as a nonprofit, a 501c3, which is exciting. The Mental Health and Substance Abuse Coalition was really established several years ago. People started talking, but we were formally established just a couple of years ago. We had hired some strategic planners, consultants with Boston and Bradley and WSU's Public Policy and Management Center to help us do some research, coordinate conversations with community members and providers.
Hey, Jennifer, I'm going to introduce, please make sure you're on mute because the background noise is distracting. Thank you all.
But we hired those two groups to help us create a strategic plan based on research and conversation that were facilitated with various providers and community members. And it was about a year ago that the plan was finalized and we were able to get these vision, mission, and focus statements out. So the vision of the coalition is to create a community where people in crisis can find a place of hope and a path to help. And the mission is to develop a sustainable, accessible, and integrated system of care that serves people with mental health and substance use disorders who are in crisis in order to efficiently and effectively deliver services that create positive outcomes. And really what we want to focus on is that group of people in crisis who might have a mental health disorder, a substance use disorder, might or might not be experiencing homelessness, really where those three areas intersect. Those tend to be the population that has that faces the most barriers. So, but utilize the highest amount of services. So we really wanted to be able to address those needs while at the same time helping them improve their quality of life. This is a list of the coalition board members. We're trying to get people from various sectors of the community that serve in leadership positions, because we understand that this is a really complex problem, issue, not problem, but it's complex and it requires leadership in order to make system-wide changes. So we have people from the criminal justice department, the mental health and substance use disorder centers, hospital systems, as well as private sector staff. So we tried to get everybody within various sectors. We have 15 spots on our board of directors, filling 14 right now. So we have a pretty good group of people who are able to provide some really good leadership to the coalition. Out of the strategic plan, we were really able to identify 3 priority levels. On the left of the screen is just some successes that have been system-wide community collaboratives that have been successful recently. The ICT integrated care team that has a person from the fire department, or is it the EMS? ComCare has a social worker, and then Wichita Police Department has a law enforcement officer, and they actually go to the person in crisis with a mental health need and hopefully serve them in place. So that's the most recent success. But we also have a community crisis center and drug court that was established several years ago. And as far as the coalition goes, there's 3 priorities: access to care, workforce, and then the communication, coordination, and collaboration. The next slides will go over those specifically. The goal of our workforce task force is really to have enough employees to meet the demand in the mental health and substance abuse, social work, and other behavioral health professions. really we noticed that people or the positions within various agencies that serve our focused population
I'm
have
probably gonna not eat all this chicken.
multiple
I mean, if I put some in the
Hey, Zach.
freezer bag,
Hey, Zach, as much as I want to hear about your dinner, I want you to mute so we can pay attention to this. Thank you.
The behavioral health workforce in Sedgwick County is really struggling in filling all of the positions. So we're trying to figure out what we can do as a community to fill those positions. And a lot of that has to do with recruitment and retention. And we're trying to look at creative strategies to recruit graduates from state universities, not just the ones locally. So what that task force has really been doing is engaging groups like Greater Wichita Partnership and looking at how they recruit in the areas of aviation and some of those major sectors, and seeing if we can advertise Wichita while also advertising jobs. So we're trying to look at ways to get people here and to fill positions, and also non-traditional benefits. There's a few other things that are policy driven, like raising Medicaid reimbursement rates, and because in order to be able to increase wages, we're going to have to be able to have income coming in. So those rates haven't increased for a while, but our policy group later on, I'll explain a little bit more about that, is working on with the legislators on addressing some of those changes.
Do you also want to talk about, when you talk about employment and you talk about workforce, Jennifer, do you want to just touch on, we have like psychiatrists, they're aging out.
Right.
We're having a real, from my chair, I'm concerned about having enough folks to care for those and have that expertise to care for those folks, because when you go to school for a really long time to get your education, if you can move to have a reimbursed education fee, right? So if you can go somewhere else and somebody pays for your student loans, right? I'm sure we all have some student loans that we've either paid or paid off. I congratulate you if you've paid yours off. But we're seeing that issue. And so maybe later when she's talking about policy, that's one of the things as policymakers talking about the reimbursement for those graduates to stay here rather than going someplace else and having their tuition and fees paid. I don't know if you want to talk about how many people are aging out. Like they're retiring, right? They spent their whole career.
They are
retiring.
We're short psychiatrists and medication providers, and a lot of the psychiatrists in our area are at the verge of retirement. I don't know the specific number. I don't have that number in front of me, but it's high. And it's not like we're not getting people coming to Kansas getting their psychiatry degrees. What's happening is what you just brought up. They're getting their education and then going to areas that offer loan reimbursement or loan forgiveness. And those programs are in underserved areas. And Sedgwick County, I believe, isn't classified as one because of the number of providers we have per capita, but it's kind of offsetted by the VA because the VA has a lot of providers from my understanding, and they serve a very targeted population, and they're counting that in our numbers of providers. So I think that there's some federal level type policy that needs to change, or state programs developed in order to bring those types of programs to Sedgwick County.
Yeah, like in Texas, for example, and Representative Elizabeth Bishop, has been sort of working on what they are doing in Texas. I think it's a 5-year program where you have 5% of your tuition reimbursed as long as you're working in a certain area. And so trying to bring that here to keep people here is just one example of what's being done across the nation that we could maybe model something after here in Kansas to keep people here.
Yep. That's definitely, and that is something that is going on, that they're trying to work towards in our policy group. But they also understand that in order to get people in positions that we need to look at those Medicaid reimbursement rates, because in order to be able to bring more income into our programs, we could I mean, if we were able to do that, we would have the opportunity to compensate employees better. So there's various things that we have to look at when we look at workforce. The second strategic priority after workforce is access to care. And the goal is to really reduce barriers so patients can get the services they need when they need them. And right now we've broken that task force into 2 subcommittees, one policy, and we're in process of finalizing a policy briefing so we can ensure consistent messaging to our legislators. And then we have another subcommittee that's focused on barriers, and we've divided those into 4 separate barriers, which is access to care, transportation. I have the other ones there. It's further down along on the slide, but we're really trying to break them down in order to be able to find the barriers and get the opportunities established so we can focus in on activities that we can implement in Sedgwick County, or agencies that can implement more activities in order to be able to resolve some of those barriers. Some of the possible measures of success were listed by the consultants that did our strategic plan here. But really what we're trying to do is reduce the number of people in mental health crisis, hopefully reduce the amount of people incarcerated because of mental health issues or substance use disorders, and get them connected to care quickly. And then finally, the third strategic priority is coordination, communication, and collaboration, with the goal to create a system of care that relies on improved communication, coordination, and collaboration among service providers. And that task force is divided into 2 subcommittees, one focusing on dashboard and the other really focusing on a database. So we're looking at a dashboard subcommittee, creating a way to have a community-facing technology or website platform so people can get connected to resources when they need them. And then the database is more of a provider-facing technology that we're looking at different vendors or different possibilities, but that will allow an opportunity for providers to share information so we're not duplicating efforts. We're coordinating care between providers, and people are getting connected to the resources they need quickly and efficiently.
So Jennifer, can you just give us an example of some of the challenges that this database will help us overcome? So like, give us an example of make up a patient.
Yeah, I was going to do that. I was going to say, so say we have a gentleman who comes into contact with the Mental Health Association. They have a case manager, and he comes in, he's in crisis. He just became homeless about a month ago. He had been working with the housing authority and maybe Open Door on getting housing, and is in process of getting an application. He's also on probation, let's say, and he has contact with the police department, so they have some records on them. And then he sees a medication provider through ComCare. Let's say they have all those people who touch this person, but Mental Health Association isn't super familiar because it's a new client. So what they could do, hopefully, is if there's a way to bridge their record keeping databases that they do individually, just to see basic client level information, so that MHA provider is not referring them for medication or starting a new housing application. We're hoping to find a way that information can be shared so we can get people connected quicker. That takes getting a universal release so privacy issues can be resolved and everybody's in agreement with how we can share information, but also requires, obviously, software that needs to be developed and created in order to get a bridge program like that established.
Yeah, and this is going to help the person receiving the care, because think about how many times you have gone in to anything and you've had to explain yourself to person A, person B, person C, and you're constantly explaining things. Well, if you could explain it to someone and then they could check you out in a system, and then the access points are going to be regulated, right? So not everybody's going to be able to see everything, but they could see maybe who you did touch, and if if our system is working correctly, our mental health association will have a contact. All of us are pretty much familiar with each other, right, Jen? I mean, we've all kind of been working with each other in these groups. We've done all this networking. And so if Jennifer, we'll say she's at ComCare, she calls Lacey over at the Mental Health Association, and we can better provide care quicker to these folks, so that it isn't as frustrating when they're trying to receive services, because they won't have to explain themselves a gazillion times to a bunch of folks.
Exactly.
When you're in crisis, right? When you need help, we just want to make it easy for folks to receive the care that they need, and for providers to administer the care as well.
And really our goal is not to, the coalition doesn't want to be the sole provider. We're not the people providing the service. Our goal is to really help our system work better together.
Facilitate.
It has a lot of things going well. We have a lot of providers providing good services. So we just want to work smarter, not harder. So some of the coalition accomplishments, I just listed a few. We've done a lot, but we're continuing to work with Brenda Dietzman with Wayfinder Consultants. She used to be the undersheriff and is retired. And then we're working with WSU's Public Policy and Management Center on implementation of the strategic plan. So the three of us work very closely together, and we're doing some great work. Again, we've finalized some policy briefings, and that really just helps with consistent messaging and provides an opportunity for people to have something in their hands to give to legislators and to have the legislative acts in front of them. We're in the process of developing a website, and right now we want to have like a resource library there while we're getting that dashboard established, just so people have somewhere to go to get information provided. And we hope that ties into 211, because we understand that they're doing good work over there too. And that data sharing collaborative is huge. I think every conversation we have when we talk about coordination and collaboration with providers, they're talking about that data sharing, finding a release that works for everyone, and getting people connected to care quickly. Workforce is going to be an ongoing issue, and I really hope that we're able to resolve some of the policy issues as it relates to our workforce, as well as recruiting. I'd really like to see us find some creative recruitment strategies in order to get people from universities. Like KU has a good social work program. I think it's Fort Hayes, or there's a lot of places that have graduate programs, undergraduate programs to fill the positions that we have a lot of vacancies for. So if we can get them to Wichita to work, that'd be great.
Well, and hopefully the new school that's going in downtown I believe they will have a program. And we can talk more about that later.
And that's another thing that they were talking about. Right now, it's not our focus, but it could be, is getting, because right now there's specific professionals who can provide the services, but even is there a mental health technician or new programs or certificates that could be offered that would be sufficient and meet the requirements to provide services to folks? That was in early stages of conversation. And of course, you only can focus on a few things at a time in order to have some success, but that would be an opportunity too, maybe. And then the sequential intercept model was a huge success. So the coalition was awarded funds under the Victor Murdoch Fund that's supported by the Wichita Community Foundation. And that was able to bring a sequential intercept model workshop to Sedgwick County, which is really, we had 51 people come that were in leadership positions across the court system, criminal justice system, treatment system, in order to create plans within the, I could talk for like an hour about the sequential intercept model, but there's different intercepts in which a person comes in contact with the system, with the goal really of the workshop being getting people tied to mental health and substance use disorder treatment quickly rather than getting them entangled into the criminal justice system. It's an evidence-based model that's recognized by SAMHSA, and it's going to provide opportunity for Sedgwick County. We just got the final report from that, so I'm going to read through it and hopefully we can get some work done. And then finally, community engagement. The goal of the coalition is really to engage community providers, community members, and the people that we're working with in order to serve them and improve our continuum of care. They said it was, they gave me 10 minutes and I think I went over that. So any questions? Commissioner Cruz, did I cover everything that you wanted covered?
Yeah, Nalini, did you have a question?
No.
Okay.
I have a quick question. This is Madison. I know that you're still kind of in the beginning phases of things, but if we are not on the board, how can we as community members get involved in this and help?
That's a good question. We do have, our intention, this was pre-COVID, was to have biannual summits, which include any community member that really wants to go to these summits. So we are trying to get something arranged that will be virtual soon. And that would be an opportunity for anybody really to come to one, get to know the work that we're doing, but also have an opportunity to provide input and feedback. And as far as the subcommittee and the task force work, we really are trying to keep that small and focused in order for us to get work done and get it done quick, not quickly, but smart. It's really hard as groups get bigger. It's hard to get a lot
more complicated.
But we do understand that this is a very important topic for everyone. 1 in 5 people are affected in some way by a behavioral health issue or substance use disorder. So we understand that the community at large is very interested in this topic and want to provide an opportunity for you guys to be able to provide input and feedback.
Awesome. Thank you.
Yeah, and Madison, those 3 subcommittees, and I think there were even some subcommittees in the subcommittees, but the access to care, the communication, collaboration, and coordination, I think there's the policy section of that. So, I mean, really kind of whatever you're interested in, we could probably get you hooked up with whatever part you'd like to, you think you could best contribute to. Jennifer Madison works with seniors at the Park City Senior Center. She's the director there. So she could be a valuable voice just because of the population of folks that she works with. Are you seeing an increase in like social isolation, or Madison, or how are the seniors doing in Park City?
I mean, generally they're doing okay, but I have seen a tremendous increase in isolation and some instances where, because of social isolation and some mental health issues, they have come in contact with the police force, and it's just been pretty crazy. So it's something that I've been dealing with quite a bit recently.
Yeah.
What I could do is I can put my email address in the chat, and you can, if you have any interest and involvement or want to meet, just have a discussion between you and I, we can definitely do that too. I can schedule a Zoom and we can get together and we can figure out how you to be involved.
Perfect.
Yeah, my email's in the chat. So yeah, please feel free to give me an email, or I'll put my phone number too, if that works better.
Thank you.
Yeah.
And Jennifer, you didn't really tell your cred, your street cred, but she's been doing this work for a very long time. She was very instrumental in getting us that Rupert Murdoch Award. She has really been busting her tail to get all of this organized. Her leadership and just knowledge base is really, it's very important to this work. So I appreciate you, Jennifer, for always being there to answer calls, answer questions, putting all of this together. We really can't do this without you.
No problem. My pleasure.
Thank you for joining us and informing us tonight, Jennifer.
Yep, thanks for having me. Again, that my title, my job is all to support our communities in this coalition's work. So if you have an interest, feel free to reach out to me and I'll be available.
Thanks,
I have a
Jen.
question. I'm sorry, I have a question real quick.
Yeah.
When you were talking about the workforce, are the positions that you guys are looking for, are they all licensed and degree positions that you're looking for?
No, well, so they can be from peer support, people with lived experience, and that's a high school diploma or GED, to case managers who are bachelor levels or have experience. It has to be equivalent to the education, or there are master's level or medication providers who are APRNs or psychiatrists. So it's a wide array of providers, and we need them in all positions. I mean, if you went to our career, what's the success? There's a success factors. You would find multiple positions just in comm care, but this isn't just a comm care issue. This is a human services issue that needs employees different positions. It's not the fact we don't have jobs, we just don't have employees to fill them.
So this makes me think, and you touched on it when you were talking about the workforce. Whenever we need people to work in the aircraft, the education providers around Wichita seem to make a short-term class or streamline the process for these different positions to supply the aircraft companies. Do you see that happening for any of these mental health? I remember a long time ago at what they called the VOTEC, they had LMHTs, and I think it was licensed mental health technicians. And to my knowledge, they don't have that anymore. Do you see that as something the vocational schools here in Wichita can do, or?
We are trying to think creatively as far as different certifications that could be offered or had in order to fill some positions. We do have, and I didn't mention this, in the workforce group, Workforce Alliance, WSU Tech, and then a few of the universities involved in some of that work. And so Workforce Alliance has brought up things like that, and we're just starting those conversations.
Yeah, we did have a pretty robust conversation with Dr. Sherry Utash at WSU Tech to figure out kind of how we could maybe put a ramped up course together. And so, any ideas that we have or any other examples from across the country, we're looking to figure out ways to be creative and build a workforce that will work for our community. And will fulfill the need of the positions that we need to fill.
Thank you.
It's hard work, but it's important work, and it's happening. It just doesn't happen fast. Well, thank you. Thanks for having me. Did you have another question?
I was just asking if anyone had any other questions.
Doesn't look like it.
Thank you so much.
All right, guys. Have a good evening. Thanks for having me.
Thank you, Jen.
Bye.
All right, Kate, thank you so much for joining us. I think you're going to give us the COVID-19 vaccine update.
Yes, I am.
The floor is yours.
All right, let me pull up the vaccine story map, and this is a new platform for our residents to follow along as we are able to vaccinate more people within Sedgwick County. Okay. I hope I'm able to share the screen and everyone can see it.
Yep.
So here we have the COVID vaccination story map for Sedgwick County, and you can access it by going to our homepage, sedgwickcounty.org, and then it is found here in the vaccination box. It's called Exploring COVID-19 Vaccine Data Story Map. So when you click on that, it will take you to this short website that we update every week based on the prior completed week. So we update it on Wednesdays with the most recent information. And then what you can find here is a variety of information about the phases and what Sedgwick County is doing in terms of vaccinations, and then what our community partners are doing in terms of vaccinations. So here we have an expected vaccine availability by population group. We are working to update this based on the governor's recently announced phases from last week. So we'll have that up to date once the website is updated on Wednesday. And then our FAQs are updated frequently as well. So we have FAQs related to just Sedgwick County, and then CDC has their FAQs as well. The story map here just kind of gives you a bit of a breakdown that the numbers are updated on a weekly basis from a variety of resources. And then we move into the snapshot, the actual data that everybody is interested in. So we know that in late December, that's when our area started to receive COVID-19 vaccines. We learned that previously the hospitals received the vaccine before the health department. The health department didn't receive their vaccine until, I believe, December 22nd or 23rd. So here we have just the two most recent completed weeks for Sedgwick County in terms of vaccine doses. And then, so we right now have a cumulative total of 5,100 folks have been vaccinated. That is a low number. We do know that we've been able to vaccinate a number of more people because the health department, as Commissioner Cruz toured, I think this morning, the vaccine clinic, were able to vaccinate, up to, I think, 1,600 and 1,800?
1,800 a day.
1,800 a day, and that's if every single appointment is filled. So we have the capacity to vaccinate more. It's just that right now we're vaccinating only healthcare associated workers, and so that population is very limited. This chart here is the cumulative COVID-19 vaccine doses given since the 13th, and you can see that there is a steady increase. And as we receive more vaccine and we move into later phases, we expect this to continue to increase up until a majority of the population receives the vaccine. And then the next figure shows the first dose compared to the second dose. Right now, we know that a majority of our folks who have received the vaccine have only received their first dose of the vaccine. And this week is when people were able to begin receiving their second dose. In certain environments, the health department has not yet begun distributing the second dose for folks who have been vaccinated by the health department. But again, we expect to see those numbers increase as we move along with the vaccination schedule. And then here is a breakdown of vaccinations compared to what the Sedgwick County Health Department is able to provide versus what other community partners are able to provide. So you'll see on the week of December the 13th, all of that was outside entities. And then the week of the 20th, that's when the health department was able to begin vaccinating folks. And so you'll see that as the schedule allows and as we are able to vaccinate more people, those numbers will continue to increase. And I might add also that the non-Sedgwick County Health Department numbers are submitted on a voluntary basis. So with the state managing the vaccination plan, we do not have the exact amount of what, Via Christi or Wesley or any other vaccine partner, we don't know what they're receiving in terms of COVID-19 vaccines. So they are self-reporting to us, and then we're providing this information in aggregate form here on the story map. And I believe that is all we have at the moment for the vaccine. But we also have a reminder for the dashboard and then our other COVID-19 story map on the page as well. So that is a very quick and dirty rundown of the vaccine here in Sedgwick County. We also have a page that is up to date with the most recent vaccine information and guidance from the governor's office. So here you can see we are still in phase 1 of the vaccine schedule, and hopefully we can move to phase 2 by the end of the month. That's what Governor Kelly had previously shared last week. And then we also have her presentation slides from last week as well for people who want to dive in a little bit deeper into her presentation. And then we've got on the vaccine page, we also have the availability for healthcare workers to schedule their vaccine, and then a variety of other resources as well. But that is just a quick and dirty review. We do plan on providing another update. The Deputy County Manager will provide an update tomorrow morning at the Commission staff meeting related to the vaccine and what we're seeing. And then we'll continue to provide probably weekly updates as more information becomes available.
Thank you, Kate, for that update. As Kate mentioned earlier, I did the first thing this morning, I went and toured the operation at Interest Bank Arena. It's pretty seamless. You have to have, for those in the first group, you have to have your license, or you have to have something on letterhead from your company to receive the vaccine. As of the numbers from Saturday, it was 7,250 doses were given. They had 516 appointments scheduled today. KDHE doesn't really find out until Thursdays of each week how much they will receive. And so we, as the Sedgwick County Health Department, have not received any more doses from the very first shipment that we received. We did get some additional doses from Grace Med, because what they received, they couldn't fulfill all of those, so they gave those to us to administer. So it's really CDC to KDHE to your local health department. That's really how it's kind of coming down. And so I've received a lot of questions around vaccines, and how, we've had months and months and months to plan, and whatever sort of job everyone thinks that we're doing, there's really a lot to it. And so a couple of additional things, when I would really recommend that link that Kate had showed. This is the state of Kansas plan. You'll see that in round 2, there's a lot of folks in that round. So, it talks about, I'm just going to pull it up real fast. Phase 2 here. It talks about licensed congregate settings. It talks child care institutions, correctional facilities, just a lot of folks in round 2. And so trying to figure out, who should be given top priority. Those are tough decisions to make, and will be made here in the near future. So like I said, we have upwards of 1,800 appointments available, but this Thursday we'll know if we get more vaccines. I believe by the end of this week, we might have exhausted what we have so far, unless we receive another shipment. So I'd love to hear your questions, concerns, or comments. Madison?
Woohoo. I do have a couple of questions. First off, when the vaccine becomes more available for a wider group of people, is the health department planning on having any other, community clinics to where the vaccine can be offered at a more convenient place for people such as seniors? I know that's kind of looking ahead, but I've had a lot of questions about that. And then, I'm sorry.
Do you mind if I answer that real fast?
Sure, go ahead. Yeah.
Hey, please feel free to chime in at any time. So I know that there were pharmacies that were given doses for seniors and long-term care facilities. So for seniors who are living at their homes and not in long-term care facilities, I do believe that's the next, that's above 65, I believe. So that is, I believe, in the next round. Did that answer your question?
So basically, I guess, we've had, and I'm sorry if this is more of just a Madison type of question, but hopefully other people can get info. We've had flu shot clinics and things like that at the senior center. Like, do we see that happening maybe in the future, or should I just send them to a local pharmacy?
Madison, hopefully it's going to be a community effort. Hopefully it's going to be not just the health department. I mean, of course, we have set up multiple vaccination clinics, but we don't want to be the sole vaccinator. We want it to be a community-wide effort, doctors' offices, other clinics, FQHCs, all of these entities that are able to do it, that have done flu vaccines in the past. Kate, did you have something to add?
Yeah, I will add that, like we've been able to provide mobile testing and outreach, we do plan on working with senior centers and community locations so that especially those folks 65 and older will have a more convenient location to get the vaccine. So absolutely be on the lookout for more information. But like Commissioner Cruz said, we are also not the only provider who will be able to provide the COVID-19 vaccine as more doses become available.
Wonderful. Thank you. And just my second question would be, and you kind of answered it a little bit as far as how you vet people who say that they fit into a certain category, like critical workers, I think, in Section 2. How do you vet those people? Is it just they have to show some official statement from their work, or?
So let's just take firefighters, police officers, first responders, correction officers. Those are kind of the first two on the high contact critical workers. More than likely, they're going to have some sort of identification that will be required. So a badge, like I mentioned with the healthcare workers, something on letterhead from their place of work. Probably it'll go along that route. Teachers who have, their badge or their license. I'm sure, Kate, unless you've heard something different.
No, I would anticipate the exact same.
Okay.
And paycheck stubs accepted too.
Yes. Current paycheck stubs.
Yeah.
Okay, thank you.
I have a couple comments and questions also. First, the logistics are very impressive for how this has gone out so far. And I think an important part of that is making sure that we have kind of civilian, like community buy-in, that people are taking advantage of the vaccines that we have available, and that they have access to it, and that there is just high interest in getting that done so we can protect our community. So I think that the messaging going out is also important. Do we have, how are we communicating that to our community?
Well, I think kind of on a personal note from Lacey Cruz over here, I walked through the vaccination clinic today. It was really, really hard to hear because Interest Bank Arena is very loud and I had my mask on. So just maybe watch it, maybe fast forward it a little bit, but it is a very impressive operation. You get in and get out. I think they said that from the time you walk in the door, the time you're in the line maybe 5 minutes, the vaccine is maybe 5 minutes, and then you're 15 minutes in the waiting area to make, the observation area. So you're thinking maybe you're out in 30 minutes. That's pretty fast. But I think as a health department, as a Sedgwick County government, we're doing all we can through our social media channels, through news outlets and press releases to communicate as best we can. I'm absolutely open to any other ways or any other channels that you think that we need to communicate on, or how best it would be to help the public understand all of the phases, how the decisions are being made, because like I said at the beginning of this is CDC to KDHE to your health department. So that's really how it's rolling out. I mean, right, wrong, or indifferent, that's how the cookie's crumbling. And I hope that we'll have a community that really kind of tries to understand that as best as we can. I know that everybody wants to get it out, right? I mean, we want it to happen yesterday, but unfortunately, we're doing the best we can. Kate, what other kind of strategies do we have in the pipeline that I might not be aware of?
Behind the scenes, we have an outreach team within the health department separate from us in communications, and these folks are making personal calls and emails to a variety of different businesses, different healthcare associated worker places of business. They're in constant contact with our schools, and I believe we also have a person assigned to senior centers with Madison. I will make sure that we were able to coordinate your contact information if they don't have it. So we're also able to have that personal communication with a variety of entities that may not be as public, but still the one-on-one, what do I need to know and how can I share it with my entities? We're also working on developing a video, kind of a walkthrough of how we can do, or how the vaccine process works, similar to what you were able to provide this morning. And then we're also working on a larger scale social media campaign for folks who receive the vaccine and how they can help encourage others to also receive the vaccine. So more information on that should be coming, I believe, next week.
Maggie received her vaccine, I saw. Maggie, how you feeling?
I feel great. My arm was a little bit sore, but I was just going to add that my experience was at the health department, and I can't say enough how great it went. They kept everybody well distanced, and everything went really smoothly and really quickly. And it was really wonderful to see all the people that were giving vaccines were just so happy to be there. So kudos to all of you guys and all of that hard work, because I can't imagine all of the logistics of that. But I do have one question. I've heard several people say, and I know this is kind of nationwide, but what is the holdup on why things are rolling out so slow? Like, not just with the health department, like, why is it taking so long? They said that we were going to be working with CVS and Walgreens and things like that. And I just wondered if you guys had any insight on why things are taking so much longer than they expected. The actual vaccine.
I don't have an answer for you. I wish I did.
Yeah, no, that's fine.
And we know that the pharmacies are initially teaming up with the long-term care facilities to provide those doses. So they're not aimed at the public yet.
Okay, that helps. Well, thank you very much.
I have a quick question. Has anyone considered doing like billboards or anything like that? Because it seems like most of the outreach is being done on social media and on the county's website. And if people don't have access, to the internet, or if they're older and they don't have social media or whatever, I'm thinking that billboards might be a good alternative. I don't know how realistic that is, but
yeah, that's definitely something we can look into. As a government agency, we're trying to pinch our pennies over here, but that we do want to reach folks who don't utilize social media or the internet, because we realize we have a lot of folks out there who don't have access to that. So thank you for that suggestion, and that's something that we will talk about for sure.
Because I'm wondering if some of the companies would donate space. I think
never to ask, right?
Yeah, because it seems like a lot of the people that are in phase 2 or whatever are people who might not have social media or access to the internet. So,
Sabrina, I think you had a question. You're on mute, my friend. You're on mute.
Can you hear me now?
There we go.
Okay. Sorry, guys. It's this tech stuff. My question is, what has the county, city, health, all of these entities, what has the discussion been about people that do not want to get the vaccine or are opposed to vaccines and so on and so forth. Has there been any discussion about what's going to happen when we get to the point that there's people saying, no, we're not taking the vaccine and we're not giving the vaccine to our children, or so on and so forth? What's the discussion been about that?
Well, I think right now, considering the number that we have, it's those who want to get it can sign up to get it. If you don't want to get it, you don't have to get it. I think that's really the discussion right now. I mean, as far as when it comes to school children, that's for a discussion for sure. I have not had that. I don't even know that the county will be the decision maker in that. So I think we're going to cross that when we get there. But as of right now, there aren't enough doses, so if you don't want to get it, don't get it.
And then I have a question about, so I know we're using Interest Arena right now for distribution to healthcare workers, which makes sense, as we're going to need them covered before they start in turn distributing it to the community. How long is that operation planned to be in place?
I think that operation is going to last as long as it can until there are events being held at Interest Bank. Obviously, they're going to have to meet some safety guidelines to hold some events there, but we have some other options as far as other community partners who might be willing to open their doors to help us. And really, it's going to be a community effort. So as long as Interest Bank is available, that's where it will be. And until we need to find another location, I would plan on it being there. But as you know, I mean, I know 2020 is over, but it seemed like it was just every day there was something happening and we were really adjusting. And I think we need to give some real kudos to our health department and all the folks who are working to get this operation together, because it is massive, especially when you're dealing with public health and we're in the middle of a pandemic. We want to keep people safe. And so there's a lot of things that go into this. And I really can't speak as good enough things to say about our health department and the staff that there's a lot of volunteers too who have stepped up to volunteer their time to make sure this works. So Nalini, to make a long answer to your question, it will be at Interest Bank until it can't be. And then and I know that our team is working on some alternative options to make sure that we're able to provide that clinic in a safe, quick way.
And then do we have plans to bring in spokespeople from our community to talk about their experience? Because, I mean, just like Maggie was kind of telling us about, what she experienced, I think that would be so good, because people in Wichita will trust people from Wichita or from Sedgwick County more than they might, national spokespeople or something like that. And I think I've seen some commercials for people from around Kansas and, just watching football. But I mean, I think that would be good to include in our messaging if possible. That
yeah, Nalini, that's a great idea. And maybe I'll get over there tomorrow and interview some folks myself. I know that Tony is listening, so maybe he can help me out with that. That's a great idea, and one that I think that we will explore for sure, because you're right. Testimonials are a great way to help people understand. Maggie, hopefully you'll volunteer your services, or maybe we could just get a little clip of what she said tonight. I think that's a great idea.
And then I have a request, if Kate wouldn't mind putting that story map link in the comments for us for the website. And I had a question about our vaccine distribution in terms of the, and I know there's two different types or manufacturers of vaccine, and the emergency use authorization recommends that people get the same manufacturer that for that second dose, what is our manufacturing supply look like?
So there's Pfizer and Moderna. I don't know. Kate, you have that?
Yes, the health department received the Moderna vaccine. And so when you receive the vaccine, and Maggie can talk to this too, you'll receive a card that says when you received your first dose and what type, which manufacturer it was. So that way, when you go and get your second dose, you'll make sure that you go on the correct date, and then you'll also receive the correct manufactured vaccine.
I was just going to add that I did ask the nurse specifically that was getting me my vaccine. I asked her what the difference was. Obviously, I'm not going to be picky, but I was just curious, what the difference was. And she said that she hadn't really heard that there was much of a difference between the actual vaccines. The only one that really stuck out to her was with the Moderna. There's a 28-day turnaround between the vaccines, and with the Pfizer it was only 21 days in between. And at the health department, she told me that they would actually reach out to me to reschedule my second dose, which would be February the 5th. So that was the only difference that she could really tell me, which I was kind of glad that you asked that question, because I was like, what if they get a whole bunch of the Pfizer and not Moderna, and that's the one that I got? So that's a great question.
Also, the Moderna is for 16 and older, I believe. I think there's an age restriction with that one.
Okay.
Yep. And then also the storage capacity. I think Pfizer is the ultra cold storage, and then Moderna can be stored at a regular refrigerated temperature. So, very minor differences, but they are differences nonetheless.
All right. Any other questions for Kate or Lacey?
I have a quick question. So I understand now in phase 1, and I was looking at the Sedgwick County website to kind of see if it was highlighted which phase we're in, and I didn't notice that it was really highlighted in a way that stood out. When we move to phase 2, I would love to be able to see it very clear that we're in phase 2. Anyway, so I guess that's more of a comment or suggestion instead of a question, but just for clarity of communication, it'd be nice to go to the website and immediately know within a click or two of what phase we're in.
Okay, I think that that's something that we could clear up.
Absolutely.
All right. Thank you, Kate, so much for your time and information.
So one thing I just wanted to add, Kate, I'm going to throw a curveball. Do you have that video that we displayed? Do you have it up? Or do you have the ability to?
I'm going to let Tony bring it up.
Okay. So while they're bringing up a video, I want to make sure that we understand, going forward with this,
2021.
With our advisory board, we are live on Facebook right now. I don't know if you guys have noticed that. And I want to make sure that the public can join just like they would join if we were meeting at the McAdams Rec Center. So I wanted to ask what you all thought of the appropriate time to let anybody join our board. Just like we do with public comments at the commission meeting, you have to have all of your comments and be scheduled to speak by 5 p.m. the day before of the board meeting. So I guess I want to pose that question to this board to see what you'd like to see. I am interested in having a transparent opportunity for folks to come in and ask questions if they want to be on the Zoom call with all of us and ask their questions just like they would. Like Lonnie has been very quiet today, but he joins all the time, right? Because he's Sedgwick County's most informed citizen. So what are your thoughts on that? And what do you think the time frame should be since this meets on a Monday? Would it need to be the Friday before the board meeting if someone wanted to join? Obviously, anyone can watch on Facebook and do whatever they want with the live stream, but to be on the board meeting, how would you like to see that happen?
I think Friday makes sense. I think that would be fine.
Okay.
And if we do Friday, can we make sure that we publish the agenda by, earlier in the week, so that way they have an opportunity to see what we might be talking about to make comments? Is that possible?
Yep. Okay. So maybe by the Monday before the meeting, the next Monday, is that what you're asking? So a week before? Or the Wednesday
That would be great.
before?
I think even Wednesday would give us that flexibility to have, if we have the agenda published by Wednesday, and then, we leave open for comments or requests or for time, I guess, time during our meeting. Is that what they're requesting? By Friday at 5 p.m.?
Sure. So for anyone watching that's interested in joining, you would need to comment for next month's meeting, which is on February the 8th. The agenda would be published by February the 3rd, because that would be the Wednesday. They would need to submit their request to join our Zoom call on February the 5th. Is that okay with everyone? Melanie, do you want to take a vote on that? A motion and you want to make them?
So the, I guess, motion on the table then, or if anyone would like to make a motion to allow for public comment as outlined by Lacey. Do we have someone that would like to make a motion?
I can do it. I move that we allow people to sign up for public comment the Friday before our Monday meeting, and that the agenda be available the Wednesday before our meeting.
This is Zach, and I'll second that.
And then we do have a comment from Lonnie that why isn't the meeting open to everyone now? Won't there be so many that they would need to submit in advance? So I think that what we're proposing is, sorry, go ahead.
The last meeting that we had a few folks that didn't want to submit their names. And just like we would if you were meeting in person, you would have to sign an agenda. You would have to sign in. You would have to, kind of show who you are. And so just for transparency's sake, you would be in the room with everybody. Everybody would see you. I think the internet allows for a little bit of, I don't know what the word is, but I think it's just for transparency's sake to make sure everybody knows who's on, and we have their information to participate. Jamie, did you have a question or comment?
Yeah, so just being a city clerk, the meeting's supposed to be open to everybody, correct?
Right.
Okay, because just the thing about sending out a Zoom invite to people the Friday before, that's still not technically an open meeting to everybody who didn't submit for the Zoom invite. I know how we do it at the city is for our council meetings and also for the DAB meetings, the person in charge will ask for public comment. There will be a section where they can give a public comment, whether they sign up or not. They don't have to sign up in advance for it because they might not know what's being discussed that night. They just know that there's a meeting that night, and a question might not come up until that meeting. So that's just another option. Just kind of how we do it at the city is open it up after everybody on the board has already spoken and given their comments, to open it up to the public for public comment afterwards.
So do you send out a Zoom link and have whoever wants to join the Zoom call?
It's kind of like how you have it right now. It's on the agenda or already posted on the DAB's website or whatever board's website it is. Because like this one's on the agenda that was posted. So that's how we do it for the different boards at the city.
And Kate does, or when the agenda is published, it is published that includes the Zoom link information. And so that would be on there. I think that what we're saying is that if they wanted to have, kind of their 5 minutes of comment, if they wanted to be included in that way, then they have to sign up for the time by Friday at 5. Is that right?
It's whatever you guys want to make it out to be. That's why I'm bringing it to you, so that folks can have an opportunity to participate. Lonnie, I love your question. You're very engaged, so you know what's going on, and so I want to make it so that anybody can participate. And this is how you do it, right? So however we want to decide how you do it, that's fine. I just want to make sure that it's easy for anybody to participate that wants to, and that the rules are the same for everyone. So Jamie, maybe we could work with you to maybe write up a plan and then post it somewhere so that people know. Would that be okay?
Yeah,
you can help us figure this out.
Yeah, I can also just kind of send the policy that we have at the city for open meetings and everything.
Okay.
Just my clerkiness. City clerk habits.
My clerkiness, not my quirkiness. My clerkiness.
Well, what kind of the same.
That's great.
Okay, so then I move that we just table the motion for now until we have something written up, and then we can discuss further. Does that sound good?
That's fine. Deb, were you gonna?
Do you need a second? Yeah. I was just gonna second that.
Okay, so we have a second to table the motion. All in favor? Oh, wait. Okay, it looks like we have all hands raised. Thank you, guys. Motion is passed. I did want to ask about the high school position. Did we have any applicants, or are we still looking for someone?
I've not received any applications as of yet. I probably need to post that, get a little bit more. I need to communicate it a little bit more. So unless you guys have somebody you'd like, I'll post that after this on my Facebook page, and in an email.
And then,
I may have somebody interested, so I could let us know maybe tomorrow or something like that if you'd like as well.
Sure, if you could just have them fill out the application. Let me find it. Kate, would you mind posting that in the chat, the application?
Looking for it right now, and I'll post it as soon as I find it.
Okay, thanks.
And I just wanted to be sure, did all the new board members receive their CAB packet?
No.
Hopefully those were sent out. Is there anyone that doesn't have a CAB packet, either in print or electronically?
We are compiling those, and those will be ready to go for everyone with the new information by end of this week.
Oh, okay, great, thank you. And then I know we voted on revised bylaws last meeting. Do we need to sign that somehow?
So that'll be included when we have the packet that goes out there. Since everyone did it virtually, we can do the electronic signatures.
Okay. And then if I could take a minute to just ask, are there any other topics that the board members are interested in hearing about as we look forward to 2021? I know we have some things that we talked about last time. I mean, mental health has got a lot of things to it, but also just giving us ideas of people that we can bring in to have discussions. And I know there's a little bit of idea generation in our Facebook group as well. So, but if there's anyone who wants to put anything out there, just always feel free to let me know, or
and also if there's any tours that you guys want to do, I'd like to make sure that you know that that's available. If there's a department or anything that you'd like to know about, be sure to reach out to me. I want to make sure that you have access to things that you're interested in to help you be more aware, or just anything that you'd like to learn about.
Are there virtual options for tours?
I don't know. Probably not. I mean, maybe. I don't know. Unless, I don't know. I would say hold off on a tour if you want to do it virtually for now. You might, I mean, a conversation with the director could be, a 30-minute conversation, or however long it needs to be to discuss, or, ask your questions. That would be available, I'm sure.
All right. Well, any other business or questions?
So real quick before we go, we put together a video that I'd like to share with all of you. It's mental health focused, and I'd love for you to share it with all of your friends and family after this, because it is so important to understand the help that's available and to seek help if you need it. So, Kate, if you wouldn't mind just push and play, thank you. Is there some sound? Will you pause it so that we can get the sound?
Yes.
Thank you. I really just sprung this on them. It's 3 minutes and then we'll be done. So hopefully we'll get it to work. If not, maybe we could just send it out in an email.
Were you guys not hearing anything at all?
Well, I thought I heard a like piano or some like sound. Is that right?
I was gonna say the sound's playing in the room, so that kind of perplexes me. But we'll hit it again, and I'll adjust the volume up higher if that helps.
Okay.
Do you want me to hit play or just wait for your?
Maybe it was just me. I didn't hear it.
And it does start quiet, so we'll try again.
Okay.
Today, more than ever, we're finding it more and more difficult to cope with the world around us. But there is hope. Feeling this way is more common than you might think. In fact, 1 in 5 adults in the United States experience mental illness. 1 in 25 U.S. adults experience serious mental illness. And 17% of youth between the ages of 6 and 17 experience a mental health disorder. The statistics are troubling. Depression is the leading cause of disability worldwide. People with serious mental illness have an increased risk of chronic disease, like diabetes or cancer. 50% of all lifetime mental illness begins by age 14. 19% of U.S. adults with mental illness also have a substance use disorder. 1 in 8 of all visits to U.S. emergency departments are related to mental and substance use disorders. Suicide is the 10th leading cause of death in the U.S. and is the 2nd leading cause of death for people ages 10 to 34. The average time between the onset of mental health symptoms and treatment is 11 years. It's important to know the signs so you can seek treatment early. Common signs and symptoms can include feeling very sad or withdrawn, excessive use of alcohol or drugs, significant weight loss or gain, drastic changes in mood, behavior, personality, or sleeping habits, intense worries or fears that get in the way of daily activities, severe, out-of-control, risk-taking behavior that causes harm to self or others. We all need help at some point in our lives, and it can be difficult to take that step to find the answers we are searching for. ComCare seeks to reduce the statistics and help everyone struggling get back to the lives they want to live. ComCare can help you or those you care about. You are not alone.
So Kate, that would you mind sending that link out to everyone? And if for those who are interested, if you wouldn't mind sharing this on your channels. This is really about ComCare, I think, is often confused with being only for homeless folks or being only for those who don't have money. But ComCare is for everyone, regardless of socioeconomic factors. So that's just something that I'd hope that folks can understand, that resource is available if you don't know where to call, or if you can't get into your primary care physician. I think it's important that we all understand what resource is available, and ComCare is one of them.
I will include that.
Yeah, is she going to be able, Kate, can you share that through email?
Yes, I will provide the link via email this evening.
Okay, great. Thank you.
Yep.
All right. Well, I think it's 7:24, so we will wrap things up if there's not anything else. Thank you so much, Kate, for helping us out tonight. And we have a motion to adjourn.
I think your little one made the motion.
I move we adjourn. This is Madison.
I'll second.
All right, and all in favor? Meeting is adjourned. Thank you guys so much. We'll see you on February 8th.
Bye.